Thank you so much for joining us for a special Ask the Experts Facebook Live to kick off Lung Cancer Awareness Month. We have three Moffitt experts from our thoracic department that are here to answer all of your questions and share the latest on this topic. Joining me is Dr. Lary Robinson, Director of Moffitt's Lung Cancer Early Detection Center, as well as Michelle Smith, Moffitt's Mobile Lung Cancer Screening Program Manager, and Lisa Sloan, Tobacco Treatment Specialist. Thank you all so much for being here. Now, before we get underway, just a few quick reminders for our audience. Please submit your questions in the comments section, and we'll do our best to get answered as many as possible. Please keep in mind that we cannot offer any personal medical advice or make a diagnosis via Facebook. And additionally, Facebook is a public forum, and any comments or questions asked here are visible to the public. Now, to get started, our first question is going to be for Michelle. Michelle, lung cancer screening saves lives, but not everyone who is eligible gets screened. Can you talk to us a little bit about the work that Moffitt Cancer Center is doing to bring screening directly into communities?
Absolutely, Megan. Thank you. And thank you, everyone, for being here today. Moffitt Cancer Center is actually bringing lung screenings directly to people's doorsteps. We have the only mobile lung screening truck in the entire state of Florida with a low dose CT scanner on board. We go to churches, senior communities, employers, and health fairs, the places that people are already going. And we pair each clinic with simple, friendly education and outreach so that people feel comfortable and they understand the process and the need for lung cancer screening. The CT scan on the mobile unit takes less than 10 minutes, and we're there to help with scheduling. We have a whole organization at Moffitt that does insurance verification and authorization. We're making lung cancer screening easy, close to home, and convenient for everyone. And if you are a community health focused person, an employer, or an advocate, please reach out to us. We would be so happy to bring that lung screening truck to your area.
Thank you so much, Michelle. And just so everyone who is watching this knows who exactly qualifies for lung cancer screenings, what are the age ranges, and maybe some of the risk factors that make someone eligible?
Sure, no problem. So, Moffitt Cancer Center follows the NCCN, the National Comprehensive Cancer Network national guidelines, which means that for people who are age 50 or older, a current or former smoker, and someone who's smoked for 20 years. However, most health insurance plans will cover a preventative lung cancer screening if you're between the ages of 50 and 80. Medicare will cover you up to age 77. If you're a current or former smoker, if you're a former smoker, if you've quit within the last 15 years, and if you've smoked a 20-pack year. And calculating your pack year is very simple. It's just the number of packs per day that you smoked times the number of years that you smoked. And as long as you have no signs or symptoms of lung cancer or you haven't had a CT scan in the last year, your health insurance should be covering these screenings as a preventative cancer screening. The mobile lung screening program also offers free lung screenings to those that do not have health insurance, making it possible for everyone to get screened. And I'd also want to mention that these are yearly scans for people whose low dose CT scan results are normal. Keeping up with annual cancer screenings is so important because changes can happen over time. And if we want to catch anything as early as possible.
Absolutely. And Michelle, another question for you. What barriers do people face when it comes to lung cancer screening, and how is your team in Moffitt overall working to remove those barriers?
That's a great question, Megan. Some of the most common barriers we find going out and meeting people where they are is we hear a lot of, I didn't know I was eligible, or I've never heard of a lung cancer screening. So going out and talking to people with awareness and education and telling them about lung cancer screenings. We've been doing lung cancer screenings for a decade. the utilization for lung cancer screening is extremely low. So, getting out and talking to people is our number one priority. We break down the barriers by bringing the screenings directly to the people, close to home in places that are familiar to them. And again, we provide that clear, friendly education so that people are informed. When insurance allows us, we also take walk ins for on site scheduling, and our team at Moffitt guides these patients through every step of the way. We're here to make lung cancer screening easy, convenient, and within reach for all communities across the entire state of Florida.
Now, we do actually have a question from Madison, who's joining us from Facebook. She asked, how do these screenings on the mobile lung unit work? What exactly is it like?
It's very simple. You walk into the mobile lung screening unit. There's about 4 steps to walk in. We have a registration area. You meet our registration person. She checks you in. If you have not signed your consents online, she has you sign the consents right there in the registration area. You walk through a sliding door. You meet our CT tech. You lay down on the CT bed. Within a matter of minutes, you're done having your CT screening and you exit the door. It is that simple.
Quick and easy, what we love to hear. Now, for all of you who are just joining us, we do have our experts from Moffitt's thoracic department joining us here today, answering your questions about lung cancer. Be sure to post your questions in the comment section below. And please keep in mind that we cannot offer personal medical advice or make a diagnosis via Facebook. Additionally, Facebook is a public forum, and any comments or questions asked here are visible to the public. Now, the next question that we have is for Lisa. Lisa, thank you so much for joining us. And we want to ask you about how people are often surprised at how quickly the body begins to heal after quitting smoking. Can you walk us through what happens in the first 30 minutes, 1 week, or even a year after someone quits smoking?
Yeah, that's a great question because sometimes people are very pessimistic. I smoked for so long, is it really worth it? And then they're just delighted at the results. We know that like blood pressure improves 20 minutes after smoking, but a patient doesn't feel it. A smoker doesn't feel that, right? They tell me, "Oh, Lisa, I'm not using my inhaler. I'm breathing so much better. My wife says I don't wheeze at night." I mean, there is so much surprise delight as people recover from smoking and their confidence grows. I didn't know I could do it. I feel so much better. I'm so glad I did it, even though it's a daunting process to get started for some people.
Thank you so much. And when it comes to support, what tools and resources make it easier for people to succeed?
We have so many resources that complement each other. So sometimes people come to me and they say, I've tried everything, but trying everything together is a totally different story. So offering all the opportunities, allowing patients to bring their personal experience, and then um, designing a program that's they walk away saying, yeah, I can do that. I'm going to do that.
Thank you so much, Lisa. Now, the next question that we have is for Dr. Robinson. Dr. Robinson, the lead clinic has shown powerful results in catching lung cancer earlier. What kind of impacts are you seeing in terms of detection and patient outcomes?
Well, thank you, Megan. We started the LEAD program to really coordinate all of our efforts. The LEAD program involves the screening program, which Michelle is instrumental in that. We have a surveillance program that follows people who've had lung cancer treatment that appears to be curative, and then probably very importantly, we have what's called the indeterminate lung nodule clinic, which I tend to run. Indeterminate meaning you have a lung nodule, we're not sure what it is. The important thing is that lung nodules are very common. Probably if you take people over the age of 50 and you did a CT scan on them, ignoring their smoking status, probably as many as 50 or 60% will have some kind of nodule. But like a lot of things in life, size matters. Size of your wallet, well, the size of your nodule makes a difference. A lot of people have very tiny nodules. I have some, probably, Michelle has some tiny nodules, and they have no, they're not important. The important thing is to figure out where it starts to be of concern. And that's where I think we've made a great deal of impact in folks who come in who have nodules of concern. And I think that's where we really find people early. We find people who have lung nodules that are very early stage lung cancer and very curative. But we make sure that this is available to everyone, particularly if they've had screening with us or screening elsewhere and are found to have nodules. They're so common, you need to really see someone who has a, a good experience with lung nodule experienced physician so that you're not having overly treated or too many tests that you don't need.
And Dr. Robinson, a lot of lung nodules are found by accident during scans for other issues. Why do so many of these go undiagnosed at first? And how does having a specialized clinic really help change this for patients?
Well, it's really estimated that probably at least 1.5 million, probably a lot more than that, people are found to have a lung nodule every year. This is incidentally. Most of these are not in screening programs. These are done, people go and they have a calcium score CT scan, or they go to an emergency room where they had some chest pain and they have a CT angiogram, see if they had a blood clot to the lung. A lot of different things are found. The problem is they go to the emergency room, a nodule will be seen. Ah, we don't have a lung, you don't have a blood clot to your lung, you're in great shape. And then the nodules are lost. It's estimated probably at least 60% of the lung nodules that are found incidentally on these other types of scans are never followed. So that's a real problem because if they are cancer, they will show up later when somebody has symptoms and they spread. And that's the importance of, if you have a nodule, at least have someone who is knowledgeable about lung cancer or knowledgeable about lung nodules to at least have it evaluated. And that's where we've set up our lung nodule clinic so people have that available. And you also have to make sure that somebody goes to see a physician or medical practitioner who has experience in lung nodules. It's about 60-70% of the lung nodules are seen by folks who don't follow the guidelines. There's lots of really excellent guidelines on what you should do, size of the nodules, what they look like, and so on, and they're not followed because people are unaware of it. I know a lot about lung nodules, been treating for a long time. Ask me about a breast nodule, you know nothing about that, go see a breast person. So you really, physicians, healthcare providers, they tend to be somewhat specialized, and make sure you're going to someone who's really knowledgeable about a problem, particularly if you have a lung nodule.
Thank you so much for that information, Dr. Robinson. And I would love to know, what are you most hopeful for when it comes to lung cancer treatment and early detection and where we're heading in the future?
Well, that's what's sort of exciting is that it was really 2013 when they first came out about recommendations for lung cancer screening. Even though we have not done very well in getting people in for screening, it has really raised awareness so that people who are found to have lung nodules otherwise are starting to be seen and evaluated. And the way you can tell that's the case is there has been a very interesting, what we call stage shift over to early stage lung cancer. That is to say, instead of finding so many people with late stage disease where it spread someplace, we're finding more and more people with stage one disease where it hasn't spread outside the lung. And as a consequence, the cure rate for lung cancer has really continually gone up. And it started really about 2013. Now we're up to, it doesn't sound great, but about 28% of the people who are found to have lung cancer are long term cures. As little as 10 or 15 years ago, it was down about 10, 12%. So when you're talking about uh, probably 250,000 people who develop lung cancer every year, a small increase in the cure rate makes an enormous difference in the number of people. Actually, if you could get everyone who is now eligible to be screened for lung cancer, that's about 15.5 million people, about the number of people who live in Pennsylvania. If you could get all of those people in theoretically to get screened, we'd find enough cancer, early stage cancer, to cure about 80,000 people every year in the United States. That's enough people that could fill the Washington National Stadium twice. So it's a real opportunity, and we're getting there, but it requires education of the providers and of the public themselves.
Thank you so much, Dr. Robinson. A lot of great information. Now, for all of you who are just joining us, we have experts from Moffitt's thoracic department here today answering your questions about lung cancer. Be sure to post your questions in the comment section below. And please keep in mind that we cannot offer personal medical advice or make a diagnosis via Facebook. Additionally, Facebook is a public forum, and any comments or questions asked here are visible to the public. Now, we do have a question from Edward from Facebook. This question is for Michelle. Currently, what is the distance that the mobile lung cancer screening unit travels to provide screening services? And will the ultimate goal be for it to travel throughout the entire state to provide screening services?
That's a great question. Our generator is good for 2,000 hours before it has to go in for service. So we can go all over the state of Florida. It's just a matter of logistics. So one of the biggest logistical issues we run into with our truck is, first of all, the weight of it. It's 60,000 pounds. So we always have to make sure that we not only have the room, but that we have a solid surface to park this truck on, because we can't get stuck in the sand. We can't be parked on any kind of soft surface. So as far as how far we can go, we're willing to stretch it. I mean, this is the only truck in the state of Florida. We're happy to go as far as we can go for whoever would like to have us, so that we can help save more lives in this wonderful state of Florida.
Thank you, Michelle. And this question from Pat from Facebook is for Dr. Robinson. What kind of clinical trials does Moffitt offer for lung cancer? Can you talk a little bit about that?
Well, lung cancer is, first of all, if you have early stage disease, very early stage disease, small nodule, 1 centimeter, a half inch diameter, and so on, your best treatment, assuming physiologically you can tolerate it, is to have it out surgically. And if it's an early stage cancer, lymph nodes negative, etc., there's no real trial because the cure rate is so very high. It's well over 90% cure rate. When you start getting into more advanced disease where you may have some lymph nodes involved, or you have non-surgical treatment or non-surgical disease where it's spread and it's not removable by surgery, or even metastatic disease, there's standard treatment involving immunotherapy, what we call targeted therapy toward certain gene abnormalities. So there's a lot of different standard treatments. However, here at Moffitt, we have at least 18 different trials for lung cancer of various stages, more advanced stage, using a whole variety of very innovative efforts to treat people, involving immunotherapy, of various immune response stimulators. The most exciting part of cancer in general treatment has been able to stimulate your own immune system to kill cancer cells. And there's a whole variety of ways we're doing that. And so there are an awful lot of trials. It depends on exactly what your stage is, and various aspects of your particular cancer. It used to be one cancer, everything fit, into the same mold. If you had adenocarcinoma, the lung, most common kind, one size fits all. Now we're very selective because you can look at the genes that are on the cancer and determine whether you're eligible for a certain trial or a certain drug. It makes a big difference. And this individualized, personalized approach to treating cancer, both with standard therapy and with various clinical trials, has made it a very exciting field.
Thank you so much for that, Dr. Robinson. And this question is also for you. Is the radiation from screening dangerous? That is what someone from Facebook asked.
Well, that's a very important question because people have a lot of misunderstandings about radiation. First of all, radiation is when you get radiation, it's measured in what's called millisieverts. It's the unit we use, named after the physician who actually described radiation. So just walking around on Earth, you get about 3 millisieverts a year. If you go up higher, for example, in Denver, it may be as much as 5 millisieverts a year. A low dose screening CT scan gives you less than half of that, gives you about 1.4 millisieverts. If you take a cross country flight from New York to San Francisco, it's about zero point 0.5 millisieverts. If you work in radiation areas where you wear the little badge and they monitor how much radiation you're exposed to, we try to limit that to less than 50 millisieverts a year. And we're pretty sure that you have to have at least 100 millisieverts a year to have any risk of getting cancer. So what we're talking about is that insignificant amount of radiation with these low dose screening CT scans. So that should not be a reason, but that is a significant concern people have, and they just need to be educated about the actual numbers.
And we have another question for you, Dr. Robinson. Julia from Facebook would like to know, is immunotherapy safe and effective for lung cancer?
Immunotherapy has probably been the most exciting thing that's happened with advanced cancers, and now we're actually using it for further earlier stage cancer. Immunotherapy doesn't kill cancer cells. Chemotherapy or drugs work very well, actually kill cells, but they have a lot of side effects. And that's what we've used for years. Immunotherapy doesn't kill any cancer cells at all. Cancer cells uh, have learned how to hide from your own immune system by a whole variety of different reasons. It's taken us 60, 70 years to sort of figure that out. And now we have drugs that block the way the cancer cell is hiding from your own immune system. So it blocks the blocker so that your own immune cells can kill the cancer. So it's a very effective method. And as in the result, immunotherapy side effects are much, much lower than, say, traditional chemotherapy and are very effective in a lot of individuals. It's quite exciting.
Thank you so much. Now, for all of you who are just joining us, we do have experts from Moffitt's thoracic department joining us here live today, answering your questions about lung cancer. Be sure to post your questions in the comment section below. And please keep in mind that we cannot offer personal medical advice or make a diagnosis via Facebook. Additionally, Facebook is a public forum, and any comments or questions asked here are visible to the public. Now, this question is for you, Lisa. Can you walk us through some of those specific resources that Moffitt provides for patients if they're wanting to quit smoking?
There's three kind of go-tos. One is a service for the state of Florida, Tobacco Free Florida, and it is available for anybody who wants to quit. You can use the resource by the website, a phone counselor, or group class, and it is a recommended standard. Many people complement that effort with a visit to their primary care doctor. There's prescriptions that are available to lower the cravings, make that success a little um, more gentle. And there's also, Moffitt patients. We have our tobacco treatment program where we target the individual needs of each patient wanting to quit.
Thank you so much for that information. And we do have another question for you, Dr. Robinson. Can you get lung cancer even if you don't quit smoking? That is from one of our Facebook viewers.
If you don't quit smoking, you have a if you're a smoker, you have a 1 in 6 chance of getting lung cancer. Period. Now, the other 5 don't, although they may get a variety of other cancers, premature heart disease, chronic obstructive lung disease, a whole bunch of other things going on. So if you're a smoker and you get a screening CT scan and you don't see anything there, it looks good. Don't just go back and say, "Well, I'm fine. Don't worry about me," because you really have an extraordinarily high risk of getting lung cancer in the future. And the best thing to do is stop smoking. And if you need people like Lisa that can help you stop smoking, it's very, very important. Now, the question comes up, what if I don't smoke? At least 25% of the people, particularly women who get lung cancer, are never smokers. I saw one yesterday in clinic. I see probably at least one a week, lung cancer in a never smoking female. So that's a very, it's disturbing and frustrating because we're not sure exactly what to say. Should those people be screened? Well, you can't screen every woman in the United States. So who's at elevated risk? And we're trying to come up with ideas on perhaps non-smokers who should get screened, and realistically, who should get screened. The things that increase your risk is particularly if you're a woman, if you have a first-degree relative, mother, father, sister, brother who gets lung cancer, particularly early in life, you have a slightly elevated risk of lung cancer. If that person that in your family who gets lung cancer is a never smoker, you say your mother's a never smoker and get lung cancer, then you're up there a little higher in terms of risk. Getting cancer itself is multiple factors together come to give you a cancer. So the more factors you have, the more risk factors you have, the more elevated risk you have. So if you have, say, your mother is a never smoker, gets lung cancer, and say you worked in a heavy smoke filled area during your the first few years of your life, then you're up there at elevated risk. Now, should you get screened? Well, and I get this question all of the time. I'll see patients in clinic and their families with them, their daughters are there or whatever, and they ask me, who should I get screened? Well, first of all, I think the big thing is lung cancer rarely occurs below the age of 50. So if somebody's thinking about getting screened, probably at least you should wait till you're at least age 50. And then perhaps you may consider, if you have a lot of risk factors and not smoker, consider getting a low dose screening CT scan. You may need to get a prescription from your doctor, and you may have to pay for it on your own. The insurance may not pay for it. I should mention that Moffitt allows you to get a screening CT scan at cost here. I think it's $178 now, and you can get a screening CT scan, and it'll be read just as like everyone else. Now, it's $178 nowadays is not an awful lot. That's about like a family of four going to a nice restaurant, and you're going to pay the same amount. That is without wine. You'll be paying a lot more with the wine. So just give that some thought. And if you're negative on that screen, then maybe every 2 or 3 years. I was asked that question yesterday by one of the people who works here at Moffitt, and that's exactly what I told her. Again, we don't know for sure about the never smokers who should get it, and we just have to kind of do some kind of guesstimate.
Thank you so much for that information, Dr. Robinson. And now this question is for you, Michelle. If someone watching walks away and takes one thing from today's discussion, what should it be?
Stop. Don't wait. If you fall within the guidelines for lung cancer screening, please get your lungs screened and then start talking about lung cancer and the importance of lung cancer screening. The more we speak up, the more we can break the stigma and help people get the care that they need. Together, we can knock lung cancer off that #1 cancer killer spot. But it's going to take all of us advocating for people to get a preventative lung cancer screening.
Thank you so much, Michelle. And Lisa, I'm going to ask you the same question. What would you say is something that you want everyone who joined in on today's discussion to walk away knowing?
Hmm. There's a lot of good information out there today, and I think that what Michelle said, the screening is really important. And if you are considering quitting smoking and you're in the mud, right? You're like, "Ah, it's so hard, I don't know." Get some resources. Find your way, try again. Every quit attempt brings you more wisdom. You're not starting from scratch.
And Dr. Robinson, to close things out, I'm going to ask you the same question. What do you want anyone who joined today's discussion to walk away keeping in mind?
But I think the big thing is to realize lung cancer has been thought of by the community as being, a uniformly fatal disease. If you have lung cancer, you're going to die. So what's the use of trying to find it screened, or why should I stop smoking, et cetera? If I get lung cancer, I'm going to die. And that's absolutely a myth. Maybe that was the case 50 years ago. It's changed dramatically. Enormous number of people, survivors from lung cancer, now are becoming an enormous group of individuals in the United States. Early stage lung cancer, find it with screening. Michelle emphasized how important it is. If you're concerned about it, get screened. If you find a lung cancer early, chances are you'll go through, have it taken out. You'll go right back to work. You go back and doing all the things you were doing beforehand. You'll have a little bump in the road and an awful lot more road, because most people with early stage lung cancer are cured. And even what's more exciting for all of us is people who have later stage disease. That used to be a definite death sentence. People would never go more than, months and maybe occasional years. Now people are out with stage 4 disease spread all over, immunotherapy, all the different things they have now, who are out there 3, 4, 5 years out. In fact, the medical oncologists are starting to use as we say, the C word, the other C word, the cure word for their patients. And that used to be never the case. So I would just emphasize the importance of realizing lung cancer can be cured. It's much easier if you find it early, and screening is the only proven way to find lung cancer early.
Thank you, Dr. Robinson. A lot of really great information to keep in mind as we go into Lung Cancer Awareness Month this November, which is right around the corner. Now, thank you so much to all of our panelists for answering these questions. And thank you to everyone in the audience for joining us today. For more information on our thoracic department at Moffitt, please visit our website, moffitt.org. I hope everyone has a lovely rest of your day.